My guest in studio is Dr. Cheme Etuahini. He's the Director General of the Ghana AIDS Commission. Doc, you're welcome to Eyewitness News.
Thank you, Omaru.
If you could just kindly come close to the microphone, I'll be happy.
Okay.
Yeah, how are you doing?
Very well.
How long have you been with the commission for? I mean, Ghana AIDS Commission.
How long?
Have you been with them for like a long time or?
Yes.
Okay.
Since 1st January 2023.
Wow. Oh, then you are new. 2003.
2003. So
that's 20 years ago.
Yes.
Wow. And how has it been like with the commission? The stigma at the time, I'm sure, would have been worse than we have now. Is it reducing?
Yes,
but
it hasn't changed significantly. Stigma is still a major challenge for us, and unfortunately, we see a lot of stigma even in health facilities, and that is more concerning because they are taking care of people living with HIV, and if they approach their work, on the basis of stigma or discrimination, then it will drive people who need the services underground and prevent them from accessing the services.
So these are the workers or the patients? Would it be the health workers who do the stigma?
Yes, some of them. And I must admit that a lot of investment have been made in that area where we've tried to make the health facilities, persons living with HIV friendly, key affected populations friendly, and so that they can have services in a stigma-free environment.
Okay.
But there have been a lot of staff changes in the health facilities, transfers, some leaving the country, and we do not have the resources to retrain people who come in and give them the proper orientation. So they come in with, the mindset, the negative mindsets about HIV, and they tend to exhibit some of the stigma-related behaviors.
Let us talk about the measures you're putting in place to deal with the stigma, the various campaigns you're running. But what is the state of you call it prevalence rate?
Yes.
So what is that? And what are the latest statistics that you're sharing with us? And what period is this covering?
HIV prevalence is currently at 1.66%.
What does prevalence mean?
What the prevalence means is actually the rate of let's say the proportion of people who live with HIV in the country.
And it's
1.66. So
1.6% of the 32 million Ghanaians are living with
adults
okay,
aged 15 to 49.
Okay. Why not up to 60 or 70?
Right. This is the statistic we actually use for determining the prevalence.
Okay.
But that doesn't mean people beyond 49 are HIV free. No. So we have data on the number of people who live with HIV in the country who are above age 49 and below age 15 as well.
So this 1.6% represents what? In terms of numbers?
So I will have to look at that, but I think the best information I need to provide at the moment is what is the total number of people living with HIV in the country.
Okay, that's fine. Which includes those above 49 and those below 15.
Exactly.
Okay, and that's what number is that?
That's about, it's almost 355,000. That's the exact number.
More than 250,000.
Yes, exact number is 354,927.
And this as of when?
This is as at the end of 2022.
Okay.
And sex breakdown gives us 115,235 for males and 239,692 for females. And age disaggregation also shows that children under 14 and younger, 24,712, and 15 years and above is 330,215.
This 354,000 persons living with HIV, is this a high number or a low number based on what analysis you've been doing in the past? Looking at the trend, is this high or low?
Well, I would want to see zero persons living with HIV in the country, because the higher the number, the more challenging it becomes for a country.
So the reason I'm asking this question is that if it was 1 million 10 years ago and it has come down to 500,000 5 years ago and is now a little over 250,000, I'm seeing progress.
Okay.
That's what I mean. Are we seeing progress or retrogression? Is it increasing from, say, let's say 10 years ago it was 100,000 and now it is 350,000? How is it climbing or reducing? That's what I mean.
Okay, let me put it this way. HIV is lifelong disease. Once you acquire it, you will live with it for the rest of your life. So which means that if HIV, the numbers have to reduce, two things must happen. One, some of the HIV, persons living with HIV may have to emigrate from the country to reduce the number.
Okay.
Or die.
Okay.
So that the numbers come down, because without any of these two, you are not going to see the numbers coming down. Now, with antiretroviral treatment, persons living with HIV are living longer.
Okay.
And therefore, we are expected to see an increasing numbers of people living with HIV if new infections remain high. Okay. And AIDS deaths decline.
Okay.
And so
the number will be high. Okay, talking about new infections, how is that looking? What do you have stats for new infections?
Have remained significantly high in the country over the years, although we are seeing declining trends. But the level of trend is below the appreciable limit that we would want to see. For example, in 2022, 16,574 people became infected. And it was about 18,036 the previous year, which is 2021.
So that's a reduction.
So that's a reduction of about almost 8.4%.
Okay.
Right? But our target is to have 17% reduction every year.
I see.
So which means we have a deficit or gap in HIV new infections so far as declining numbers are concerned.
Okay.
And so it is important that we reduce new infections significantly, to the barest minimum, in order to achieve epidemic control, especially if that must happen along with, significant declines in AIDS deaths.
Let's talk about AIDS deaths now. What's that number looking like?
AIDS deaths in 2022.
22.
Thanks for correcting me.
It's fine.
It's been a long day.
Lots of numbers in your head too. Sorry.
Yes. So 2022, 9,359 people died of AIDS. And that is worrying, because in this day and age, nobody should, have advanced HIV disease or what you call AIDS. Okay. Never mind dying.
Why?
Of AIDS-related causes. Because we have treatment. Antiretroviral treatment, first of all, boosts the immune system. It actually helps the immune system to regenerate and fight off suppress the virus and fight off all kinds of opportunistic infections. And so with antiretroviral medicines, we see viral suppression, which gets to the undetectable level. And that stage, the person will not transmit the virus to his or her partner sexually. And we also see that there is no disease progression, and so there cannot be any HIV advanced disease, and so there will be no AIDS-related deaths. And this number of AIDS-related deaths makes AIDS one of the leading causes of death in the country, and that should not be. But why are we having advanced HIV disease? It's because people who have HIV, some of them have not tested. They don't know. And often sometimes they don't even go to hospital. Or when they go to hospital and they are not diagnosed, then they will live with it, and it becomes difficult for them to know the cause of the illness. And when they have advanced disease, then they begin to spiritualize it. And before it gets worse, that's when they go to hospital again to see if there can be a last minute, remedy, solution. And when it is too late, when you are at the last stage of HIV infection, your chances can be dire, although antiretroviral medicine can help you recover. Some of them don't make it. And so everybody has to know his or her HIV status. And
the knowing of the status and the testing, is there no stigma around it? Could that not be the reason people do not want to go and do it?
Yes, but the stigma has no basis. HIV is no longer a death sentence because of antiretroviral treatment. You can have a normal life. You can live, normally like anybody who doesn't have HIV.
Okay.
You can have your normal lifespan if you adhere to the treatment. And especially if you become virally suppressed and you maintain the viral suppressed status by taking your medicines daily as directed or prescribed, you will have no HIV-related illnesses.
But still, it's easier for you to say, but it's very difficult for people to walk into the hospital and say they are coming to test their HIV status, isn't it? So what options are there for people who may be shy to go?
So now we've introduced self-testing.
Okay.
Self-testing is for free if you receive it from the community-based distributors or the online distributors. If you go to some pharmacy shops, you may find them, but you have to pay for it.
Okay.
But the program ones are for free, at least up to the end of this year. So that is giving people, especially the underserved population and hard-to-reach population, to have access to test kits and test themselves in the comfort of their homes.
So you can go to, so where do I go to? AIDS Commission, or I have to go to the CHIPS compound in my area? Where do I get it if I wanted to?
You can get it in some of the CHIPS compound. There are also NGOs who are working in the communities who are distributing.
And you can also go to the pharmacy and buy a test kit.
Yes.
Is it like
not all of them sell HIV test kits?
Okay.
But some do.
But so it means there are test kits in Ghana if you want to, just like we have a pregnancy test kit that you can buy and take home and test yourself.
So we launched the campaign just a couple of weeks ago.
Okay.
To create the awareness and demand for self-test kits.
Does it require you to prick yourself and take out blood to test in your room, or you urinate like they do with pregnancy, or how do you test yourself at home?
Yes, there are invasive test kits which requires blood for the testing. But what we have is rather an oral swab.
Okay.
So you just swab your upper and lower gums with the kit.
So you put you put the thing in your mouth.
In your mouth.
Okay.
Yes. And so run it around your gums.
Like the way they do the COVID tests.
Exactly.
Okay.
And then it will show you what to do the test, how you should read and interpret the results.
And you can do all of this in your own room alone.
In your own room.
How long does it take for the test kit to tell you? Do you have a rough idea?
If you do it well, within 20 minutes, you should see the results.
All right. Let's move on so people can go grab test kits if they want. Antiretroviral drugs, you've talked about them. Are they easy to come by? Do we have enough supply in Ghana? Are they subsidized?
Currently, we have enough supply, and they are provided by the Global Fund.
Okay.
Government also provides some, but it doesn't come frequently.
Okay.
Our partners, the Global Fund, provides antiretroviral medicines for 125,000 of the
population
of the HIV population,
okay,
which is currently 355,000. So government is supposed to provide for the remaining 225,000 so that we can have full coverage. However,
government is being government. Don't say it. Let me say it for you.
Oh, thank you. Thank you. And so we often ration the medicines and we often run short of them.
We are rationing antiretroviral drugs in Ghana?
Yes, sometimes.
What does rationing mean?
What it means is that we have a policy of multi-month scripting, which means every person living with HIV is given 6 months allocation of drugs, especially when they are stable. Stable means they are not having any challenges, whether side effects or having their organs being affected by the drugs or any other thing.
Okay.
And so they can have the medicines, for a longer period, 6 months, and then they come back to refill.
Okay.
And rationing means we are not able to give them the 6 months allocation, maybe 3 months, 2 months, or 1 month.
Because the supply is not enough.
Exactly. So sometimes even come to 2 weeks or 1 week.
Wow. And that doesn't help with your fight.
No.
Let's conclude now. We have a minute to go. What's the one thing you want Ghanaians to know, and maybe duty bearers, so we leave?
Well, what Ghanaians should know is that we have the right strategies, we have the tools, we have the human resource capacity in the country to enable us achieve the 2030 targets, which means ending AIDS and achieving epidemic control. And achieving epidemic control means that HIV will no longer be a public health threat in the country. We have everything to achieve this within this decade. However, we have huge funding gap, as I've just explained. The people who live with HIV, their continued existence depends solely on daily intake of antiretroviral medicines. If we run short or we do not have the money to provide the medicines, it's like, people that are on oxygen, who
don't have supply.
Who don't have supply of oxygen. Or oxygen is taken off them. And then the obvious end is death for them. And it's the same for people living with HIV.
When you talk about funding, you are a commission under the presidency, aren't you?
Yeah.
You don't get your budgetary allocations?
No, currently there is no specific budgetary allocation for the HIV program itself. Every now and then, maybe once a while, we get something from the NHIS, That is the Ministry of Health use its share of the NHIS.
But don't you have
proceeds.
an annual budget as a commission?
We have budget for the commission's operations.
Okay, for running, not for the HIV
not for
campaign.
the HIV itself. And that is with the funding gap is about 67%. Our donors expect not only Ghana, all countries to provide 60% of the funds required for HIV. And they will provide 40% because they are also having financial crisis and their funding has continuously reduced. And so currently the donor funds are altogether is about 33% of what we need.
So the gap is huge.
The gap is huge and we need Ghanaians to support. Otherwise, we are going to see reversal of the gains that we have made so far. And lives will be at risk and we will not be able to reduce new infections as we have, purpose. Therefore, we have as a commission, come up with a USS code, which is *9898#. You dial and follow the prompt and donate to the ACE fund.
*9898
hash. Yes.
*9898#
Yes.
to support the HIV campaign.
Yes.
To prevent risks of life. Thank you so much for joining us in studio, sir.
You are welcome.